Stunning developments in Washington tonight. The United States President Donald Trump has been flown to a Washington area hospital after testing positive for COVID-19. Hello, I'm Anand Naidu, and this is The Heat. Within the last hour, U.S. President Trump was flown by helicopter to Walter Reed Medical Center to be treated for the coronavirus. The White House says the president is fatigued and suffering from a low-grade fever. First Lady Melania Trump and several White House staffers have also tested positive. The diagnosis comes just days after a contentious debate with former Vice President Joe Biden. Both Biden and his wife tested negative for the virus on Friday. We begin our coverage with CGTN's Toby Muse right here in Washington, D.C. And Toby, this story developed overnight, Thursday into Friday here in Washington. We heard that the president and his wife, First Lady Melania Trump, had tested positive. Then we didn't hear much from the White House during the day. But just a short while ago, the president did issue a very short statement. This is what he had to say. Let's watch.
I want to thank everybody for the tremendous support. I'm going to Walter Reed Hospital. I think I'm doing very well, but we're going to make sure that things work out. The First Lady is doing very well. So thank you very much. I appreciate it. I will never forget it. Thank you.
So, Toby, what's the latest?
Indeed, as you say, it was just under an hour that he was flown to the Walter Reed National Military Medical Center. He was wearing a mask. He was walking unaided. Now, officials say that he will remain at the Walter Reed for a few days. They weren't specific. But I think it's important to note just how quickly this has escalated. So very early Friday morning, around 1 o'clock, the president announces that he has contracted the coronavirus. Now, during midday, the White House is putting out these signals saying that he is suffering from mild symptoms. Here's what the White House Chief of Staff had to say earlier Friday.
As all of you know, the President and the First Lady tested positive for COVID-19. They remain in good spirits. The President does have mild symptoms, and as we look to try to make sure that not only his health and safety and welfare is good, we continue to look at that for all of the American people.
And then later in the afternoon, Friday, Trump's physician publishes a memo where he says that the president is receiving an antibody cocktail along with zinc, vitamin D, and other medicine. The physician now describes his condition as fatigued but in good spirits. And now in the evening, the president is taken to the hospital. We understand that the first in the president's inner circle to have contracted the coronavirus was Hope Hicks, his trusted aide. Now, the White House has cancelled the president's events for the coming days, but he is not the only one in the senior Republican circles to have got the coronavirus. Ronna McDaniel, the chair of the Republican National Committee, has also tested positive. Now, it is important to note, though, that the president, since the beginning of this pandemic's appearance here in the United States, has consistently minimized both the fatality and the risk of the coronavirus. He's been loath to wear masks in public, and he's frequently mocked his rival, Joe Biden. He's mocked his use of the mask as a precaution.
And Toby, to put this in some kind of political context, this has all taken place just 32 days out from the U.S. presidential election. What kind of impact is this going to have?
I mean, it's just immediately upended what was already a very unpredictable election. Obviously, for the time being, Trump is being taken away from the campaign trail. Now, his rival, Joe Biden, is continuing to campaign. Joe Biden announced today that he had taken a test for the coronavirus. He tested negative. Let's remember, those two men shared a stage with that contentious debate earlier this week. Now, regarding there should be a second debate. Now, that has been scheduled for the 15th of October. Now, Mitch McConnell, the Senate Majority Leader of the Republican Party, has said he wants to see that debate go ahead, but he's talked about the possibility of possibly doing it remotely. I think it's important to note that the formats of these debates can take months between the two campaigns to negotiate exactly any sort of changes like this, so it's going to be interesting to know. And really, another question is, will Trump be able to get back to those rallies he was so famous for? the rallies that he said won him election in 2016. But the situation is just so fluid. To even think about a week or 2 weeks from now, many people are just trying to figure out what comes next. What will tomorrow bring?
Thanks, Toby. That's CGTN's Toby Muse reporting. Well, we have much to discuss. Let's bring in our panel. Joining us from Charlotte, North Carolina is Mary C. Curtis. She's a columnist for the political publication Roll Call and host of the Equal Time podcast. From New York, John Burnett is the managing director and founder of One Empire Group. Also in New York, Nate Lerner is the co-founder and executive director of Build the Wave, and Dr. Kate Tulenko is the CEO and founder of Corvus Health and joins us via Skype from Washington, D.C. And Kate, let me start with you. You're the expert, you're the doctor. Looking at the sequence of events from the early hours of this morning, right until a few minutes ago when the president was admitted to Walter Reed Hospital, what is your reading of the situation?
Well, it certainly moved quite quickly. So we know that he tested positive late Thursday. And it seemed that he initially did not have symptoms, but then developed fever, fatigue, cough. He was then given Regeneron's IV antibodies, which are antibodies against COVID and have been shown to reduce symptoms and to reduce viral load in people who are not hospitalized with COVID.
1, 2, 3, 4, 5.
But despite being given this, he still continued to have symptoms, and it has now been taken to the hospital, presumably so they can monitor his oxygen level, because we have seen that people can have low oxygen levels even without major symptoms. And of course, the president is quite at risk due to his age. He's 76, due to the fact that he's overweight and also the fact that he's a man, where we see much higher mortality rates in men. So it is a concern.
Kate, what can you tell us about this experimental antibody treatment?
So it's a recombinant antibody treatment. So it's basically antibodies that are made by bacteria that will bind to the COVID virus and deactivate it. And it has, as I said, been shown in clinical trials to reduce symptoms. It's seen as relatively safe. Often the biggest side effect could potentially be an allergic reaction,
right,
but that often happens quite quickly, and he didn't have that. So it is very safe, and this is a treatment that would not be available to the average American. It is being given to severely ill people, but the average American with minimal symptoms would not have access to this.
One other point, Kate, you know, we saw the president on the video walk by himself from the White House to the helicopter. He got off the helicopter himself. But the fact that he was taken from the White House to a hospital, what does that tell us?
I do say it's an abundance of caution, but it is indeed concerning that they felt the need to take him. I mean, the White House is only a few blocks from George Washington Hospital, where presidents have received care in the past. So it is indeed a concern that they felt the need to take him. But given how important a U.S. president's health is, especially in the month before an election, on one hand, it's not surprising. I think we'll all be watching very carefully over the next 24 to 48 hours to see how he does.
Several other people in the White House have also tested positive. So in terms of the protocol right now, what happens in terms of contact tracing at the White House?
There have been a number of concerns raised over this. There were some people who had close contact with Hope Hicks that found out about her diagnosis via the media rather than through contact tracers. And it does appear that the president went to a fundraiser in New Jersey on Thursday night knowing that Hope Hicks had tested positive. So he may have, in a way, knowingly exposed people in New Jersey. And so given the fact that the White House just had the recent meeting for the nomination of Amy Coney Barrett to the Supreme Court, we see videos of a lot of handshaking, a lot of hugging there. They're going to literally have to contact hundreds of people as part of the contact tracing. And also, I think this opens both the president and the White House up to potential legal charges for knowingly exposing people to COVID.
John Burnett, of course, as we have been discussing, this takes place just 4 weeks before the presidential election. What's your assessment of how this will affect that election?
You know, as my fellow guest stated, that Trump is best when President Trump, I should say, is best when he's out there engaging people. But we've seen, Trump adapt to his environment. That's what good business people do. So I expect him to do more video engagement on various topics and things that he wants to tell the American people. However, I think this was more about risk management, him going to the hospital more than anything. Why? Because we want to make sure that the president is fit and can get through the 10 to 14 day quarantine period, so that way we can have a second debate. I think that's extremely important. The thing is, the President Trump can now even make a greater connection with many of the American people that have either contracted the disease, actually experienced someone within their family or friend circle who have passed away, or impacted in a myriad of different ways. You know what? He could say, I too have contracted it. So let's actually get through this together. And hey, he could be one of the first individuals to take the vaccine.
But John, as you point out, the president's campaigning style is to be out there, to be pressing the flesh, to be right there in the midst of crowds. He's held these live rallies. Does he now forego all of that?
Well, we'll have to see. We know at least with the remaining 30 days, at least 15 days of that time period, he will not be out there engaging individuals. So he will adapt. He will seek opportunities to give updates directly to the American people. And that is what is unique about this president. He doesn't like to go through intermediaries. He likes to give that message directly. And given the current circumstances, he will adapt. Why? Because he's a businessman. And that's what you have to do. Adapt to circumstances, but not succumb to them.
Nate Lerner, we know that President Trump has not exactly followed the rules when it comes to wearing masks and social distancing. In fact, at that last debate against Joe Biden, his Democratic opponent, he was very derisive towards Joe Biden. In fact, at some point mocking Joe Biden for wearing a mask. Let's listen to what the president had to say.
I mean, I have a mask right here. I put a mask on, when I think I need it. Tonight, as an example, everybody's had a test, and you've had social distancing and all of the things that you have to, but I wear masks when needed. When needed, I wear masks.
Okay, let me ask.
I don't wear masks like him. Every time you see him, he's got a mask. He could be speaking 200 feet away from it. He shows up with the biggest mask I've ever seen.
So, Nate, given what we have just seen over the past 24 hours, how does this change the conversation about the wearing of masks, about practicing social distancing?
That's hard to say. I think it's still too early. But one thing is clear is that Trump certainly got his just desserts. This is karmic justice for Donald Trump downplaying the importance of masks, downplaying the significance and the threat of the virus, undermining the science, questioning the science for months on end. This is a man who we didn't see wear a mask until July 11th in public. New York State had a law in mid-April requiring all residents to wear a mask. I was out wearing a mask at grocery stores whenever I went out in mid-April, and Donald Trump was not seen wearing a mask in public until July 11th. So honestly, he's getting what he deserves here. I wish him well. I obviously don't have any ill will towards him, but at the same time, based on the way he's behaved, based on how little respect he's had for the science behind this, he's getting what he deserves, and I hope that his supporters and people who have not appreciated the importance and the value of wearing a mask will recognize that this is actually a serious threat, and masks are a way to help prevent the spread. So is social distancing, so is washing your hands, so is staying inside when you can and holding events outside. And Donald Trump has, with complete disregard for all of the guidance, has been holding rallies, often going against state laws to do so, not wearing a mask, and he's getting what he deserves.
Mary C. Curtis, all this has happened so quickly, so fast. What is your view of what is taking place right now?
Well, I think that the president wanted to talk about everything but coronavirus. He had said that it's going to go away, not many people get it, and it wasn't that serious. And now, of course, it's at the center of everything. Just imagine a few days ago, we were talking about a Supreme Court justice, about his taxes, what he did and didn't pay. We were talking about his behavior at the debate and him seeming to give encouragement to far-right white supremacist groups. And now it's about COVID. And although, yes, he has it in common, it puts a spotlight on the fact that he was very derisive toward Joe Biden. And people can see that he is getting the best medical care because he's the president of the United States. So they can relate to him, people who have suffered from COVID, but they can also see what their own families went through when they didn't have the health care. and when they had to say goodbye to family members over the phone. So people will look at him and say,
didn't have
you couldn't...
health care that contracted COVID? Who didn't have good health care?
I'm just saying, so many people who perhaps lost their jobs in the recession, some of the folks in states
no one was
without
denied health
Medicaid.
care.
Okay, John, I will get back to you and give you a chance to respond to that. Mary, go ahead.
But you have to check lies, please.
Well,
I will
I'm
get
just
to you,
saying
John.
that so many people, you know,
She's
did
not
not
denying
have,
it. So that should tell your viewers
have the coverage that they see the president having such good care. You saw those
Nobody was
videos
denied
from New
Okay,
York.
John, I will get to you, John. Give Mary a chance. Mary, I want to ask you about
Yes.
something else. You know, we also reported earlier on that Joe Biden and his wife, Dr. Jill Biden, they also, at least they tested negative for the virus. Joe Biden was out campaigning in Grand Rapids, Michigan. This is what he had to say when he heard the news about the president. Let's listen.
My wife Jill and I prayed that they'll make a quick and full recovery. This is not a matter of politics. It's a bracing reminder to all of us that we have to take this virus seriously. It's not going away automatically. We have to do our part to be responsible.
So, Mary, despite being belittled by the president, Joe Biden, they're taking the higher ground, if I could put it that way, didn't he?
Yes, I mean, obviously everybody wants the best for the president and First Lady's health. Nobody is. And so Dr. Jill Biden and Joe Biden are wishing him that, but pointing out the fact that, that for the American people, did he have a plan for helping them deal with this virus? And so, yeah, of course they're going to take the high road because we do want, it doesn't do America any good to have a president whose health is, up in the air at this point.
Right. John, on that point of who has access to medical care and who doesn't, there are millions of people who've lost their jobs because of the COVID-19 pandemic. They had insurance that was linked to their jobs. They have lost that insurance right now. They don't have access.
Well, I think the best way to answer this question is name anyone who was denied care. During this, whether you talk about the height of the COVID pandemic or when things started to subside, no one can name one individual in any of the 50 states or territories that were infected with the coronavirus that did not have access to care that was covered through the state with federal support. So I think this actually shows, if anything, that President Trump and our healthcare system is right there with the American people. And President Trump is only going to make it better. If you can't name one instance or even a news report, then we have to stop the propaganda.
John,
I'm just saying that there are many people, though, that after they got treatment got huge bills. And they're saying, they're in the courts now to strike down parts of the Affordable Care Act. And they're saying that a pre-existing COVID could be a pre-existing condition. And there's so many people that have sickness after they recover from COVID. And they're quite worried about treatment, how they'll pay for it, and actually all of these symptoms that they have after COVID. And I do know of people who have that.
I think at this juncture, we need to focus on facts, not fear.
Okay, John, I need to move on. Okay.
In the U.S., the #1 cause of bankruptcy is poor health and medical bills. So it is indeed a problem, and people are delaying care because even though an emergency department has to give you care, they're legally obliged to give you care despite your ability to pay, you then could be saddled with extremely large medical bills.
Right.
And also, I think part of the point Mary was trying to make is Trump is also receiving a treatment that's not available to the average American.
Right.
That's the Regeneron treatment.
Right, and we've also had people on this show here who've told us that they have not had access to healthcare, people who have tested positive for COVID. Kate, I want to ask you about something else. I want to move on. President Trump has been promising the country a vaccine, which he said could be available before Election Day. That doesn't seem likely right now because this week, the pharmaceutical company Moderna said it doesn't expect to have a vaccine ready by spring of next year. We have been hearing all kinds of timelines on vaccines. What's the most optimistic scenario for you?
So the new timeline that they announced yesterday is that it probably will be late March or early April until the Moderna COVID vaccine is available to the general population. Now, they might, under an emergency authorization, be able to offer it earlier to healthcare workers or to the elderly, but that's probably just a month or two earlier. I do not think that we will see a vaccine before the presidential election. In fact, a number of the pharmaceutical companies have gotten together and issued a press release saying that it's the science and the safety that will drive their decision on releasing a vaccine.
Mary, there's also another problem that people are facing, and that is they've lost their jobs. They need money to pay rent, to pay their mortgages, to buy food, etc. The emergency relief program from the government ran out 2 days ago. The House of Representatives, where the Democrats are in the majority, has passed a $2.2 trillion stimulus package. They passed that on Thursday, but it's not expected to survive in the United States Senate, where the Republicans are in a majority. So where does that leave that stimulus package?
Well, of course, right now you're going to see there needs to be a stimulus package. And Nancy Pelosi, actually the Speaker of the House, she has been in discussions with Treasury Secretary Steven Mnuchin, and they seem to be trying to come up with a compromise because, as you say, people have rent due, evictions are coming up, and all kinds of emergencies. But it is many of the Republicans, some of whom in the Senate think that there should not be any stimulus money. And so it seems that the White House at this point, I believe, they want a deal because with elections particularly coming up, you know, people are worried.
Yeah.
And it's not very good for his chances if we don't have one. But it seems like that the Democrats are the ones that they've already brought down what they demanded. But it's the Republicans in the Senate, many of whom are saying, if you give more stimulus, it will encourage people not to work.
Yeah, John, you know, Mary makes a great point there. I mean, just to look, if you look at the politics of this, there is an election coming up. Why are Republicans in the Senate opposed to this stimulus package?
Well, you know, first I apologize for not thanking you for having me on the show. You're one of the great hosts, and it's a tremendous opportunity for me to come on your show and actually provide your viewers with common sense. And the common sense I'm talking about is this. The thing is, when you look at states like New York, you know, you can get on a plane packed with 100 people or more, right, for 2 hours, 3 hour, 4 hour flight, but I can't walk into a restaurant and sit down and have dinner. That makes no sense. Why? Because restaurants are the #1 job creator, because they're small business. So when you look at the situation that we're in economically, many of these mayors and governors have shut down their states, come up with these burdensome rules and regulations that's placing a stranglehold on businesses, hence jobs, right? The best stimulus is allowing these businesses
John,
to operate.
let me just stop you there, John.
Pick and
John,
choose.
let me just stop you there, because many, as you point out, officials, mayors in cities, are implementing these guidelines because they're listening to the scientists. This is what the scientists are telling them, that to stop the spread of the infection.
Name me one scientist that created a job, and I just gave you a scenario, but you didn't answer. Why can I get on a plane? Why can I get on a plane with hundreds of people for 3 hour flight?
All right, Kate, I will get to you.
But I can't go in.
Kate, I'll get to you. John, just finish what you have to say.
And have dine.
Yeah. Okay, Kate, go ahead.
So a recent study showed that patients that tested positive for COVID were twice as likely to have recently eaten in a restaurant compared to patients who tested negative. So eating in a restaurant is a major risk factor for catching COVID. And the governors cannot control the rules about airplane travel, but they have a moral responsibility to reduce the risk in their states over the policies that they can control.
Nate.
Yeah, and that's why when the restaurant industry in New York sued the governor actually came out with a reopening plan and made it public.
Okay.
So that kind of debunks your theory there.
All right,
thank you.
All right, John, I have to move on to Nate. Nate, what do Democrats in Congress do in the face of this intransigence?
Well, right now the Democrats have been fighting to pass a stimulus bill. Actually, John makes a great point about how What do you do if you need to put restrictions, limitations on a business? Well, the answer is you give them economic relief. The government needs to step up and do its job, support people who are unemployed, who cannot work because of the pandemic, who lost their jobs through no fault of their own, who lost their health care through no fault of their own, businesses that had to close down through no fault of their own. And the government needs to step up and support them. And it also needs to tax billionaires, tax corporations, tax those who are profiting right now off of this pandemic, cut the military budget in order to fund this. And we're not seeing that right now. That's what the House wants to do. That's what Democrats in the House want to do. But Republicans in the Senate are stopping it because they don't want to spend that kind of money. They don't want to give Democrats a win. They're arguing too much over it. But they don't have a plan is the problem. So now we're stuck in this weird limbo where states have to pass different laws. There's no guidelines coming down from the federal government. The federal government has been completely absent in all of this. And as a result, we're having the chaos that we've had the last 6 months where nobody really knows what to do and what's going on, and we're figuring it out as we go. Meanwhile, across the pond in Europe, they have very clear guidelines that they've been following since day one, and it's going a lot smoother there economically and with the pandemic in general.
Kate, on that point that Nate makes, that there's been not coherent guidelines coming down from the federal government, from the White House, do you think that's now going to change now that the president himself has been infected by the coronavirus, has tested positive?
I hope so, but we'll see. I mean, we definitely do need more of a coordinated federal response. We need the Defense Production Act to be triggered to produce more protective equipment for health workers and others. We need more contact tracing and more public health interventions. So hopefully the same thing that happened with Boris Johnson when he got ill, he changed his tune on COVID. Hopefully that will happen with Trump as well.
Mary,
it already happened.
Yeah. Okay, I just want to go to Mary. I want to go to something very quickly. We've only got about a minute, and that is, it's a question we've been hearing very often here in Washington and in other parts of the world, and that is the president is now in the hospital. Do you foresee at some point that power will be transferred to the vice president, Mike Pence? What is the sequence of events as far as that is concerned?
Well, we've seen in the past when presidents have gone, have under anesthetic, they've invoked that, saying that the vice president would take over. At this point, the president has said that he can do his job out of the hospital, and I really don't see him giving up that particular power unless he gets very, very ill. And so I just think they'll monitor him, and he'll try to have these addresses, as he has done today, to keep in contact with the American people.
Okay, and that's where we have to leave it. Thanks to all of you for being with us. That's it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.